Yes. Good afternoon, friends. I'm very happy to start this post lunch session. The crowd is thin, but it will join up. Even if 5 people are there passionately interested in something new, it'll be always a pleasure to teach. So, this talk is on oxidation, antioxidation paradox. And Paramjit had given me a keynote lecture for a whole hour. I may not take the whole hour, I'll do it in 50 minutes and give you about 10 minutes for a question answer session. We live on a polluted earth today. There's no doubt about it. Industrial pollution, hydrocarbons, pesticides, insecticides, food additives, genetically modified foods. So we are being bombarded every day with hydrocarbons, pesticides, insecticides, food additives, colorings. In Malaysia, the food I saw was so highly colored. I never seen food so colored and gorgeous because it is not only appetizing, it is appealing to the eyes also. Adult forced vaccination and unneeded childhood vaccinations. So all these are bombarding our body at cellular level and causing real trouble. Industrial pollution, indiscriminate dumping of lead, mercury, and other heavy metal products in the waste dumps, poor air quality, groundwater quality has got high total dissolved solids and heavy metals, and indiscriminate burning of plastic waste, use of non-biodegradable plastic. The list is very long and endless. These toxins affect all animal life on our planet, and as humans, we are exposed to very, very high reactive oxidative species or ROS. Photographer, sir. Here. You can take a few photographs of me. There you go. So, ROS is something about which we have been talking in the morning. And we have talked about it yesterday. We've had all sorts of complicated drawings and diagrams telling you how it is and how it affects us. ROS is an unstable molecule that contains oxygen that easily reacts with other molecules in a cell. A buildup of ROS in cells may cause damage to DNA, RNA, proteins, and will eventually lead to cellular death. It is a very, very toxic thing. And this drawing had already been shown in the morning by one of the earlier speakers, how it works and how it causes damages to our body. And the damages are at the mitochondrial, DNA, and RNA levels. How do we protect ourselves from the effects of ROS? Molecular medicine is a new field in the entire medical armamentarium that is opening new vistas into understanding human physiology, performance enhancement, age regression, and fighting and preventing a plethora of diseases. And the two wonder molecules I'm going to speak about today is the well-known ozone and the lesser-known hydrogen. There's a paradox here. Lag. There is a paradox here. Ozone is an oxidant, while hydrogen is an antioxidant. Yet, both molecules work in synergism. However, as a cautionary advice, I'm telling you that these two molecules should not be used together or on the same day. 1 spoon of acid and 1 spoon of alkali you mix in a glass, you get salt. So you do not mix them. Ozone is a molecule with a short half-life and thus is administered first as a major autohemotherapy or extracorporeal blood oxygen ozonization, about which I'll be speaking a little more later. And molecular hydrogen infusion is given with vitamin C, glutathione, and other antioxidants as it has a longer shelf life. I'm very certain that though you would have all heard of hydrogen water and hydrogen inhalation, none of you would have actually seen or experienced intravenous infusion of hydrogen. And that is a new thing that I'm going to teach you today, which is going to be the first time in your country and probably first time for you. Antioxidant therapy is thus administered 24 hours after systemic ozone administration. Molecular hydrogen is a new miracle molecule in modern medicine. Molecular hydrogen H2 has been recognized as a novel therapeutic agent in biomedicine. It has shown improved clinical endpoints and surrogate markers in a large number of clinical trials. At the end of this talk, I will be sending you a PDF file of about 60 publications on hydrogen in peer-reviewed journals, along with the PDF file of this talk for you to understand what I'm talking about. Hydrogen has also been found to be a very strong anti-inflammatory, a powerful antioxidant, and infusion of hydrogen outperforms very high dose of vitamin C, other water-soluble vitamins, or glutathione. 8 hours of hydrogen inhalation alone outperformed the oxidative effects, antioxidant effects of 2 grams of vitamin C, 2 grams of glutathione administered intravenously. And these studies were done in Belgrade. Hydrogen inhalation was found to be very effective in hepatic health, pancreas stimulation, diabetes reversal, viral infection, hypertension, COPD, and autoimmune disorders. That's a small video that shows how hydrogen is inhaled. On my back is hydrogen machine, which I've just tested. I was pouring the distilled water. And the right side is 600 ml of hydrogen is coming out. It is a colorless, odorless, tasteless gas. But you do feel good relief when you inhale it, especially in asthmatics and COPDs, where I've seen breathless people becoming practically normal within moments of inhalation of hydrogen. So you can see the machine is producing 99.99 liters, 99% of hydrogen at 900 milliliters a minute. And the patient keeps talking to you, keeps chatting with you, and the gas is inhaled. In a published Japanese study, it has found that diabetic patients inhaling 8 hours of hydrogen every night reduce their HbA1c by minimum 2 points in 4 months of inhalation. The problem with this sort of therapy is that every patient will have to buy a hydrogen machine and then keep it beside his bedside. And every night for 8 hours, he has to inhale it. So that was the problem which had to be solved so that the patient can come to your clinic. You can give him a 10 to 12 minute session and it has the same effect of 3 to 4 weeks of inhalation of hydrogen. Numerous clinical studies the world over have found that molecular hydrogen is very beneficial in a wide range of conditions, from severe hypertension to post-malignancy chemotoxicities, acute sepsis, and many patients who are moribund have recovered. Now, this is a WhatsApp message from one of my orthopedic colleagues who had just got his hydrogen machine. He said, my BP on monitor was 141/92 before hydrogen infusion and nutraceuticals yesterday night. In the morning, I played cricket for 1 hour and my BP was still 117/75. This is my observation. Is the first hydrogen infusion and nutraceuticals on myself. And the video here is what he posted on the group. There we go. The machine is producing hydrogen. This machine has been designed and developed by me in India that produces 900 ml of molecular hydrogen. That's a doctor, an orthopedic surgeon, Dr. Pankaj Katole. And if you go back to the monitor, you can see it is 147 by 97. Blood pressure 146 by 97, while he is being infused with hydrogen, which is bubbling at the rate of 600 ml per minute through a saline bottle. And that is his baby the next day in the morning after playing 45 minutes of cricket. To produce 99.9% purity hydrogen, a hydrogen generator is needed. One of the smaller machines for making hydrogen water is also being displayed in one of the stalls, but that is a 300 ml machine. For intravenous use, you need 900 ml machine. What is a hydrogen generator and how does it work? A hydrogen generator is a machine in which distilled water is passed through various levels of filters to separate oxygen and hydrogen in gaseous form. So water formula we all know is H2O. So for every 2 liters of hydrogen produced, 1 liter of oxygen will be produced by the machine. That is the formula or design. How a machine is made. There's a water tank, then there's a gas separator and a series of molecular filters through which the pressurized gas is passed. So you can see there are large number of filters through which it is pressurized and pushed. Oxygen molecule is bigger, so it will be the last but one to come out. And hydrogen molecule is a lighter one, lightest one known to us, and that will be the last one to come out. Now it becomes very clear that because the process is a combination of electrolysis and pushing distilled water through membranes to separate it molecularly into hydrogen and oxygen gases. The water should be very, very pure and should not contain larger molecules which might block the filter. And once the process is through, molecular hydrogen and oxygen are separated as individual gases. Twice the volume of hydrogen is produced as the oxygen, and hence if the machine produces 600 ml per minute of hydrogen, it will produce 300 ml of oxygen. And if it produces 1.2 liters of hydrogen a minute, it will produce 600 ml of oxygen. As hydrogen is the smallest molecule, it is separated by the last level of molecular filter. Oxygen is a larger molecule and is separated by the last but one filter. It is very important that water must not have any heavy molecules like chlorine, ozone, sodium, potassium, calcium, iron, etc. That is why we insist the distilled water which is used in a hydrogen machine, you cannot use an ordinary mineral water or tap water. It has to be TDS free, meaning there should be zero total dissolved solids. It should not have metal, it should not have iron or magnesium or calcium. It should not have chlorine. It should not have ozone. It should not have potassium or calcium. So the water has to be pure distilled water, usable for medical purposes. The water is easily available in Malaysia. And one of the doctors who installed a hydrogen machine in her clinic yesterday had gone there to do an IV drip. We could find it easily and very cheaply. If any water but pure distilled ozone and chlorine free is used, the filters will clog and the machine will not work. This is very, very important. Branded distilled water, pure TDS free, chlorine and ozone free is recommended. Do not use mineral or drinking water, else your machine is going to be messed up and it's going to be out of warranty. So this is the brand we use in India. And very similar brands, you have to mark that zero TDS ultra pure water for medical use. That has to be emphasized again and again. We have a medical grade iOS machine, and that is a machine which I have invented for intravenous use. And we've got a certification from CE that it's a medical machine for IV use. Initial results of IV infusion by our members are dramatic, and hydrogen therapy is applicable in numerous conditions. You can just look at this. One of the doctors sent me a message. This is my real sister, 40 years female, suffering from chicken pox in 7 days. Hydrogen and nutraceutical infusion given yesterday evening, and see the effect overnight. Normally, chicken pox will heal in 2 to 3 weeks. But you can just see the picture left and right. Within 12 hours of hydrogen infusion, the chicken pox lesions have disappeared. And the patient is totally pain-free and irritation-free. I studied the entire literature of hydrogen. The PDF file is the same, is also being given to all conference delegates today in the conference WhatsApp group. But despite lots of literature on hydrogen inhalation, drinking of hydrogen water, there were 0 papers or studies on IV hydrogen drips. Though antioxidant and nutraceutical drips are very popular in Europe, England, and other countries. You can see the menu that's come from England, and they're charging 100 pounds, 225 pounds, and 850 pounds for IV infusions of various combinations. But this does not include hydrogen. The first question was, is it safe to bubble hydrogen into normal saline with or without antioxidants and infuse it into human body? Everybody will say, what about embolism? What about blood clots? The one thing I want to emphasize, if we look into the clotting mechanism and the cascade mechanism, it needs nitrogen and oxygen to start the clotting cascade. Hydrogen is an alien material to us humans because though hydrogen is the most abundant element and molecule in this universe, molecular hydrogen in its native form, H2, is unknown, is not present on this earth. So because it is not present on this earth, none of the body physiology has learned to react adversely with it. However, with a strong binding capacity to any oxygen or hyperoxygen or superoxygen, molecular hydrogen is one of the best antioxidants that can ever be conceived. Question is, does bubbled hydrogen diffuse and also dissolve in water or saline? All I had to do is go to my physicist friend, and he said that in a fixed container, the dissolution of hydrogen is 7.8 into 10 to the power minus 4 millimoles per for 50 ml of hydrogen in 100 ml of water. So if you have to increase dissolution, we have to continuously bubble 600 ml of hydrogen every minute into a 5-liter bottle of normal saline and bubble it over a period of 12 minutes as it is being infused in the patient's body. So we are bubbling 8 liters of hydrogen through 500 ml of saline, and that is being transfused into the patient's body. We've all seen sports person drink foamy water or hydrogen water for their performance. Lot of advertisements come where people are bringing out hydrogen water and showing that how it helps and builds up performance. Lots of publications are there on hydrogen inhalation, but there is no publication or demonstration in the world about the role of intravenous infusion of hydrogen. And though both inhalation and drinking of hydrogen water have proven health benefits, the question that hits our head is, why not bubbled IV hydrogen infusion? Unfortunately, none had tried it in humans. Rat and rabbit experiments are also missing. Does this procedure cause any harmful effects like embolus, etc.? Can we combine IV antioxidants with hydrogen bubbling or saline? The only way was to try it on myself. Most of my contributions to medicine have been as a result of self-medication, be it pain portals or be it hydrogen or be it ozone. I first try it on myself. If I survive, I will try it on my colleague, my assistants and hospital staff. And then if we are side effect free, only then go to the patient. So that is how we started the procedure. There I am getting an IV. You can see hydrogen is bubbling into the bottle. And you can see that the hydrogen that is coming out of the bulb has got bubbles. That's 900 ml per minute of hydrogen being bubbled through a 500 ml bottle of saline. And we look closely at the bulb, you can see the small bubbles coming in. And these bubbles will go through the IV, going into my body. And this, I've just taken a few weeks ago, you can see the dates there. But one single infusion for 16 days, my exercise levels and performance levels were increased dramatically. My normal calorie consumption, 450, that is active calories burned, was 450 kilocalories per day. It jumped to 708 kcal just immediately after a single hydrogen IV infusion. Then I tried on my assistants, and this one you can see, it's a big close-up where you can see how the bubbles are traveling and how the bubbles will go through right into the vein. And this produced such dramatic improvement in my assistants that they come to me every 15 days and say, sir, this is now my time for my hydrogen infusion. All set for infusion now? One more, please. These experiments led to intravenous molecular hydrogen therapy, which is being spoken about for the very first time in any conference in the world. Nobody knows what is intravenous hydrogen therapy. Here I am disclosing you invaluable secrets of this. Hydrogen is the most abundant molecule in the universe. It's just two atoms making one molecule of H2, which is the lightest molecule. Yet hydrogen is not available in its molecular form anywhere on this earth. It's the most powerful antioxidant ever known to man. Probably 16 times more powerful than uric acid. Acting at mitochondrial level, the antioxidant effect of hydrogen has been found to be age regressive, performance enhancing, reversing COPD, in post-malignancy chemotoxicities, allergies, and numerous other conditions. Mixed with water-soluble vitamins, the new IOS methodology is revolutionary in clinical practice. Each patient who has had an experience of a hydrogen infusion is going to get you 10 more patients, provided you charge reasonably big. Video of IV nutraceuticals and hydrogen infusion. Very short video. So there we go. We are mixing 2 grams of glutathione in a 500 mg saline bottle, then 2 grams of vitamin C, and then 1 ampule of vitamin B1, B6, B12, 1 ampule of vitamin B12. So that makes our nutraceutical cocktail that is hung on a stand, and then hydrogen at 900 ml per minute is diffused through this, as the bottle is only 500 ml. To ensure that it doesn't burst out due to the pressure of hydrogen, we are putting 2 needles in the top for the excess hydrogen to escape. After priming for about a minute, you can infuse it, and it takes only 11 minutes to finish 500 ml of hydrogenated saline, which is hyperhydrogenated with close to 12 liters of hydrogen. Later, I experimented on intra-articular injections in osteoarthritis by combining ozone and hydrogen, which I call as hydrozone, with excellent results. I personally take monthly hydrogen infusions, and my sugar and BP levels as I make this presentation are this. So you can see the date, And you can see how much is my BP and sugar. I'm 68 years old. So 120 by 82 is my blood pressure, and my sugar is 110. My HbA1c 15 years back was 13.4, and my random sugar was 312. Hydrogen and nutraceutical infusions produce many wonders. Some explode, some unexplode, and many more need to be explored. Now, this is an anecdotal experience. Our last iOS conference was in a place called Pokhara in Nepal, in the foothills of Himalayas. I have not traveled to high altitude for a very long time. And though I am a normotensive individual, when I went there and returned back, I had a spell of hypertension. And this is how I started self-experimenting on hydrogen. The personal experience, not level 1 evidence, we call it level 5 evidence. And my hypertension, how it reduced or reversed with intravenous hydrogen, is shown step by step. First question, how did I realize that I had hypertension? When I am a normotensive individual, there's no need for me to check my BP. So why should I suddenly check my BP and find out my BP is high? My assistants were editing the photographs of the Pokhara conference on our return. And the girl on the right, who is my assistant, commented that my usual photographs on day 1 in the same conference were of my color, which is brown, whereas the one on the right, my face is tomato red and flushed. So she said something is wrong somewhere. So, because it was high altitude, while my students were editing the photographs, they commented that my face was flushed and tomato red. That made me think, possibly I had some hypertension. That's why my face was flushed. I recorded my blood pressure before I went for my morning walk, and I was in for a surprise. 163 by 98, 11th April, 6 a.m. before I started my walk. I was shocked. So I canceled my walk. Instead of morning walk, I went to the hospital to have my own hydrogen nutraceutical infusion. And there it was. I've shown you the clip before. Immediately after the infusion, my BP became 144 by 90 from 168, 98. And then the watch is there besides it. We can have the day and time. So this is pre, that is pre, and that is post. And subsequent pictures are my daily BP recordings. I did not take a single medication. The watch beside the BP machine shows the dates and times. So that is 149 by 89. Next is 137 by 88. That's the evening. Next morning is 125 by 85. Next evening is 103 at 10 p.m. 103 by 69. So from 163 by 98 to 103 by 69, without any medications, my BP came back to my normal levels within 48 hours. 60 mm systolic and 30 mm diastolic BP was reduced in just 48 hours with no medication. I was shocked. And what is the infusion I take? 2 grams of vitamin C, 1.2 grams of glutathione, 1 ampule of vitamin B12, 1 ampule of polybion, 600 ml per minute of 99.99% purity hydrogen bubbled. And this is my readings while I was making the talk a week back, Monday 15th. And you can see it's 120 by 77. So I was trying weekly hydrogen infusions about 26 hypertensive patients, and the drugs are being reduced dramatically in all of them. I'm an orthopedic surgeon. I do not treat hypertension primarily, but because I work in a hospital, my physician friend, I told him that whichever hypertension patient comes, let us give hydrogen IV and see if you are able to reduce the antihypertensive medicines. Next molecule is ozone, which is a synergistic molecule. Though there is some controversy about ozone in this country, I assure you that ozone is not banned in Malaysia. It was only a political controversy. Many of you are using it, and you should be bold enough to go out and use it because a lot of scientific publications are there. And it's also helpful against ROS by binding to the rogue oxidative elements. Ozone is administered either by a major autohemotherapy or an extracorporeal blood oxygen ozonization. As I travel tomorrow, I took a session today. That is, this is when I was writing this, because flight is a very closed compartment. And anybody who travels by air has a chance of getting a viral infection. So this is 1 ml of heparin, which goes into the vacuum thinner bottle, and then half ml of heparin goes into a special transfusion set, which is rubber-free and ozone-compatible. The bottle is a vacuum thinner bottle, and once the set is primed and the bottle is primed, and IV butterfly's foot, gauge 19, gauge 18 butterfly is enough, and that is connected to the set. The set is pushed into the bottle, and once it is opened, blood gushes into the bottle automatically because the vacuum in the bottle. It is a borosilicate flint-free bottle, and once 50 ml of blood is collected, we take 50 to 60 ml of ozone, 70 microgram percent. Not what is taught in courses like 20, 30 microgram. No, 70. And once the blood goes in, the ozone goes in, the blood becomes tomato red. Immediately the bottle is inverted, it is transfused, and after transfusion is over, the nurse holds the set high in the air and allows the whole blood to drain into the body. So this is a demonstration of extracorporeal blood oxygen ozonization with ultraviolet irradiation of blood in a polyarticular rheumatoid patient. I'm sorry for the bad network, so that the video appears jerky and not smooth as it appears on my computer. A perfusion pump is used. No filters are used. We are not using any dialysis filters. It is a flint-free borosilicate glass bottle. This perfusion pump extracts the blood from the donor site. It goes into the bottle. It's irradiated. And now you can see the color difference without a filter. The input blood is venous blood. Output blood is like arterial blood. So, I have finished well in time, almost 20 minutes early, so I can give you 10 minutes for questions. Take home messages. Number 1, be aware of ROS and their detrimental effects on human body at the cellular level. 2, hydrogen is yet to be a discovered medical miracle molecule. Once you learn to master it, once you learn to tame it, it will change your practice dramatically. Master ozone and hydrogen, and you can conquer many, many unconquerables. Numerous conditions can be treated with these methods, and a lot more research and publications are needed to produce high level 1 evidence, which will eventually happen over a period of time. When a new thing comes up, everybody looks at it with shock and awe. But when it produces reproducible results in many, many hands, identical reproducible results, it slowly gets accepted into the mainstream. Hundreds of therapists are using hydrogen and ozone IV therapies presently. Not many are started using IV hydrogen outside India, which has been popularized by me only. But intravenous ozone therapy is well popularized, and many in this room are using EBU and MAST. Results so far have been outstanding, and the complications have been practically nil. All therapists are welcome to join us in these studies. Let us change the history and leave the footprints on the sands of time. If you want to learn something more, you feel free to message me on this number. A PDF of this presentation will be posted on this group. A PDF of all published papers on hydrogen will be again posted on this group. And this talk also will be shared with all of you. Should you want to join a group which is totally dedicated to both oxidative and antioxidative agents, you have to message me on this number in WhatsApp with your name, designation, and location. And I will ask my staff to add you to the group and share all details and information about this. Now that I have finished well before 3 o'clock, though we started at 2:20, we have got 6 minutes for questions and we can throw the house open for questions. Thank you. Switch on the lights if you want.
Hello. Thank you, Doctor, for the short and sweet.
Yes, there's a raised hand. Give the mic
one.
there. Yes, please. Let's wait for the mic. Mic. That mic is not working. Check. Oh, you want my number on the screen again? That's it. There it goes.
Antioxidant or a pro-oxidant?
It's an antioxidant. Ozone is a pro-oxidant. Hydrogen, glutathione, vitamin C are all antioxidants. Yes, there in the back. My friend who uses hydrogen.
Hello, doctor. Sorry to say, maybe you're not familiar with Malaysia. We've been doing IV ozone manufacturing here with Dr. Tyler and Steven for last 5 years.
But IV hydrogen?
Yes, IV hydrogen. You can see it in the booth.
Oh, you're doing it, doing IV.
Yeah.
That's
Just-
good.
Just different method. But there are a lot of publications in Japan and China.
Yes.
But most of them could be in their native language. Okay. The one thing I just wanted to check with you is when you run the hydrogen gas to the normal saline, how do you maintain the sterility and how do you maintain the half-life of the hydrogen?
Question. Good question. Correct answer. Number one, 99.99% hydrogen in itself is pure. Like oxygen, hydrogen also has an antibacterial, antiviral, antifungal effect, as you've seen in the chickenpox case I've shown you. So the moment the hydrogen exits the machine, it is sterile. The drip set we are using is sterile. The bottle we are using is sterile. And we do not want the bottle to explode because only a 500 ml bottle and we are pushing 600 ml per minute of hydrogen. Though hydrogen is such a tricky gas that it will start escaping through the saline bottle, it will start escaping through the IV set even when you start it. Because unless you put it in aluminum or a dark flask, you cannot contain the hydrogen. But we need still 1 or 2 needles to outlet the excess hydrogen. And if you are putting 600 ml per minute, we are talking about 6 to 12 liters of hydrogen bubbled through 500 ml of saline in a short period of 10 to 15 minutes. And I've shown you that formula. We asked my physicist friend to run. We get a reasonably high amount of dissolved hydrogen in the infusion that goes into the body. And if you take close-up pictures of bulb which is being infused, you can see the microbubbles. And you can see the microbubbles right up to the vein as it enters into the human body. And the proof of the pudding is in eating. So when I could reduce my diastolic BP by 30 mm within 48 hours without medication, and then my patients who have had IV hydrogen drips, within a period of 90 days, their HbA1c comes down by 2 to 3 points. Only 2 infusions a month. In 6 infusions, without any change in their lifestyle, without change in the medication they are taking in type 2 diabetes, I am documented in 47 patients that there has been a reduction in their HbA1c between 2 to 3 points. So the only way to progress forward is we all take this ahead, we try it in our practice, we document, we share results, and we publish. Anyone else?
Anybody? I have one question. The effect of the drop in blood pressure, how long is it sustained?
My thing, only after this one single infusion, my BP has remained normal for the last 3-4 months. But my case is different because it was not a malignant hypertension. It was a situational hypertension induced by high altitude. So even if I had not had a hydrogen infusion, in 90 days, my BP would have come back to my baseline level of 117/78. But even having a blood pressure of 98 diastolic for 90 days makes me a high risk factor for either cerebral or cardiovascular accidents, and that reduced. A patient who is essentially hypertensive, who is on hypertensive drugs, this will help you to reduce the dose of antihypertensives by 50%, sometimes 70%. And I have not done it long enough to take out the hypertensives altogether from a patient of essential hypertension, because my experiments in controlling hypertension are only 6 months old. It may take at least 3 years for us to find out the correct answer to your question.
So a healthy person who takes this hydrogen infusion, do you think they will have a drop in the blood pressure or no?
Yes, they will have a significant drop in blood pressure.
A healthy patient who has no blood pressure issue, is it?
A healthy patient, it will not have any effect. No. If you're having a BP of 120/80, it's only oxidizing. And it's not going to cause, it's not an antihypertensive for a normotensive individual. But we have now found that by renin angiotensin mechanism with autoimmune effects and possibly some sort of autoimmune mechanism only, a person gets hypertension with genetic as well as cellular and mitochondrial level. And by methods I cannot explain or have not been studied, hydrogen infusion somehow reduces the blood pressure. As our colleague from the back who's been using it will also confirm and concur that it is a very good antihypertensive.
Any more question?
Any more questions?
Okay, thank you very much, Dr. Prakash. We hope to see
Thank you very much for Paramjit. A very, very well organized conference. We must all put our hands together and clap for her. All we owe to Paramjit that you could collect a galaxy of stars on the stage and a galaxy of participants in the audience. Thank you very much. Thank you.
Hope to see you again soon, Doctor. Next, our next presentation. Please join me in welcoming Dr. Julie.